again. But what I wanted to spend the most time on is the additional interview tool that we've added in Shelby County. So I wanted to highlight some things that we said early in the pandemic. There are limits to the information that's available, and that's limited by interview tools or databases that are used. While we are an independent health department, we historically used the databases associated with the state of Tennessee, and there were some limitations to that database. So we added an additional interview tool that helped us better understand what people did during their infectious period, so that we could use that information to drive communications as well as tailored or more precision type interventions. We have done that since about mid-September, and we look at that data on a monthly basis. So I wanted to share information about 303 interviews that were conducted in November and the information that they reported. So about half of the people who were interviewed and had COVID, so half of the 303 continued to engage in activities of daily living while they posed a risk to others. That means they were infectious and could transmit COVID to others. When we look at the types of activities that they engaged in, we noted that about 76% continued to go to work. We've all talked about job-related screening. There's also been an emphasis on assurance testing in the workplace to identify people early on so they can be excluded from the workplace. We also know that about 40% continue to go about public activities or social activities. And that's anything from going to meet with a friend, going to have a drink with a friend, going to a movie theater, and so on, but continue to be active and social in public. And only 3% indicated that they continue to engage in school-related activities. We wanted to specifically look at how many days people worked while they potentially were infectious to others. We have shared this information before and have seen a little bit of a shift, which is really positive. So about 45% of people worked about 1 day. So they continued to go to work for 1 day before they were excluded. Previously, that number was much closer to 3 days. So by reducing that number, we reduced the opportunity for transmission. But a total of 29% actually continued to work for up to 2 days while they were infectious and posed a risk to others. And this is work in all settings. And then a smaller number, just 10%, continued to work for up to 3 days. So the takeaway there is a reminder, again, if an individual exhibits any signs and symptoms, to please stay home, get tested, and remain isolated until that test result comes back, and then handle things appropriately based on that test result. I wanted to end with some comments about